Our next speaker is Mia Woodward, who's going to talk about managing post-LASIK and other ectasias.
Thank you very much, and thank you for the opportunity to speak here today. I have the following financial disclosures, which are not related to my talk. So I'd like to start with two case presentations. The first is of a 34-year-old man who had LASIK in 2006 and then went on to develop ectasia. He came in after being cross-linked in his right eye and complaining that his vision was getting worse in his left eye, but you could see with his scleral contact lens, he still corrected to 20/25, but he was concerned. The second gentleman was a 48-year-old man who had LASIK in 2000 and went on to develop corneal ectasia, and he was really coming in that day complaining of itchiness and irritation of his eyes. He found scleral contact lenses very comfortable, and very much helped his symptoms, but he couldn't afford them. They were too expensive, and that was his best corrected visual acuity. So how do we manage ectasia after refractive surgery? Well, in a traditional discussion, I would walk you through the things that we talked about already, cross-linking scleral contact lenses. And I'd like to really tell you that you have excellent resources to understand those medical managements. There's a preferred practice pattern that just came out last year from corneal ectasia, which is excellent, and you have your handout from today. But you know, my research is in AI and big data, and a lot of the fears around are we going to be replaced as physicians are real. And so I'd like to take a little bit of a different route because I feel like we've already kind of covered some of what I was going to talk about. So who are we, right? We're physicians who practice medicine to promote, maintain, or restore health. And our humanity is always going to be our competitive advantage that keeps us at the forefront of medicine, regardless of technologies. And I say this as someone who uses and develops these technologies. So who are we as physicians? We are patient-centered, and we place these medical interventions in context of our patient's care. So I'd like to just kind of walk you through my thinking and something I need to reframe myself every time I walk into a patient room, especially someone who has post-refractive ectasia after post-refractive surgery. So what is my role? Well, I think what my role is very much depends on what my role was. Was I the surgeon who did the LASIK and then the patient went on to develop ectasia? Or am I the subspecialist who can then judge this other surgeon? And it really doesn't matter. I mean, certainly the surgeon who did the original surgery had the best intentions. They didn't want their patient to develop ectasia. And so we really have to remind ourselves that we are here to treat that patient today, regardless of the mistakes of the past, and not create more mistakes by trying to treat the mistake, even if it was ours or someone else's. And I love this quote from Joe Montana, which is why he was so good. He didn't worry about the last play, he worried about the current play and the situation he was in. So what is my role moving forward? Well, I think it has to do with what the patient is thinking. Where is the patient in their decision making? Where are they in their disease? Where do they see themselves? This is the chief complaint. This is the history section. And I do it myself. I look at those topographies and tomographies, and before I've even walked in the room, I'm like, oh, they're progressing, they haven't progressed, oh, this is their, what they look like clinically, and I'm already thinking about treatment decisions. And that that's helpful, of course, we're physicians, like we do use these tools, but is it what we should be focusing on? Patients who have ectasia after refractive surgery, this happens over a very long period of time, right? Our two patients were coming in this year, 13 and 19 years after surgery, right? So this has happened over a long period of time. And they might be in a very different stage of their acceptance or non-acceptance of this condition. No one who goes into LASIK thinks that they're gonna have this, and their appreciation for that might be very different. If we talk to the patient, we can get a sense of where they are with their disease and what their current needs are. So there's the informal approach of actually just talking to the patient, and then there's a more formal approach of really assessing patients at their current stage. So patient-reported outcome measures are validated survey tools. So there's surveys, they're very easy to administer, that give you a sense of the patient at their disease state. They can be used for symptom evaluation, functional evaluation, or quality of life evaluation, and they're very helpful in clinical decision making. They're also used in policy decision, they're used in clinical trials, and they're used in regulatory and industry uses. So there are some surveys that are relevant for keratoconus, not have been done for ectasia after refractive surgery. The keratoconus outcomes research questionnaire is one of those. Most people also, though, use the NEI VFQ, which is a more general measure of eye health and has been shown to have good okay metrics with keratoconus. I'd point you to an article that came out Thursday in Cornea that really goes over some of these quality of life metrics if you want some more details. And informally for ectasia after refractive surgery, there have been subjective measures that have been used as part of the clinical trials. And you can really see patient symptoms, do not improve after cross-linking, which is something we just need to tell them. It's not the goal of cross-linking to improve their symptoms, and just be open and honest that we're trying to prevent them from progression, not help their symptoms, because it might change their decision making. We at University of Michigan in 2017 started using the National Eye Institute VFQ-9, which is a short form of the VFQ, and we administer it to all patients. We don't administer it at every single visit, but at least once a year patients get this, and post-surgically patients get this. And I have to tell you, this has really changed my decision making. I love that I have this. I actually really love it the best for dry eye patients, honestly, because it really gives me a sense of where they are on the spectrum of their concerns, but I have used it in this situation as well. So going back to our cases, the first was this 35-year-old man. His best corrected vision was 20/25. We're like, what's the problem here, but he's really concerned his vision is getting worse, and he had no progression on his mapping, so cross-linking wasn't really recommended. It was recommended he get refit for his scleral contact lenses. But as you can see, his total score was a 66, the best being 100. And that score for his NEI VFQ-9 was driven by worry and with his concerns about his eyesight quality, and then some close work. And so I think this could be used as a tool to frame the discussion. What are you worried about? Are you worried about progression? Maybe cross-linking is appropriate because it's really addressing his concern, not our concern. It's addressing the worry. Or maybe he's worried about something else entirely different about his eyesight. And again, this is a tool to then investigate and have that conversation. In the second gentleman, he had itchiness and he couldn't afford the scleral contact lenses. Certainly the management was appropriate for that. His NEI VFQ score was better than the last patient's, not 100, but better than the last patient's. And I think in this case, this could also be his medical necessity letter was written for the scleral contact lenses. It was denied. And perhaps we can use these patient-reported outcomes metrics as a tool to then go to the insurance companies and say, this person is sicker than someone else, and this is a validated tool that we can use as a weapon to help our patients get their needs met. So in summary, what is the physician's management of ectasia after refractive surgery? I think first you need to know your own role and just be reflective on where you are both in the past and in today. We really need to focus on what the patient's thinking and where they're at, either informally or formally, and then think about the medical decision making in that context. So thank you very much.